Everybody always asks me, why are dental implants so expensive? A dental implant can cost anywhere between $3,000 and $9,000. It only replaces one single tooth, and most doctors can actually place them in less than an hour's time. So why does something need to cost so much money just to replace one single tooth? And what can you actually do about it as the patient? Dental implants are expensive, but they're expensive for these various reasons. Number one is that they require a highly skilled practitioner to place them. Not any dentist can actually do implants. Let's say an oral surgeon or a periodontist, for example, those are very expensive professions. Not only do you have 4 years of undergraduate tuition, you have 4 years of dental school, and then anywhere from 2 to 8 years on top of that of tuition that you have to pay back. So the pressure to produce money so that you can pay back your loans and not go into more debt is actually pretty intense. Plus, the equipment that is required to place a dental implant and keep you safe is actually very expensive. These 3D x-rays, these cone beam CTs are no cheap feat. They used to be $100,000, $200,000, $300,000. They've come down in price a little bit, but they're still very expensive. And if you're a general dentist and you're trying to learn how to do dental implants, you need education that could be $10,000, $20,000 to get the education, plus all the equipment just to place one dental implant. Dental implants also take multiple appointments. They take an initial consult appointment, they take this surgery appointment, there's a lot of homework that goes in between appointment number 1 and number 2, like planning, digitally planning, getting a surgical guide, planning with the dental lab. And on top of that, then you need a post-op appointment and another appointment to scan and another appointment to actually put the dental implant in place, or the dental implant crown on top of the implant. Another reason dental implants are so expensive is because they're made out of high quality materials, and not just any high quality materials. There have been billions of dollars of research put into making these dental implants last a very long time. And all that research and all that time takes money. Another reason as well is that implants are a great solution, and there's nothing that we have that is as comparable to a dental implant as a one-to-one solution, meaning that we take out one tooth and we replace it one tooth. If you look at a dental bridge, people don't like doing dental bridges because you can't floss up and down like you can an implant, and they also require you to drill down the adjacent teeth or the tooth in front or behind of the missing space. And this next part, I know you might not really care as a patient because you have no control of this, but overheads in dental offices are actually extremely high. Before the pandemic started, they were around 75%. You have inflation, you have all these different issues which are making your costs higher as needing a dental implant from the patient's perspective, because the overhead of the office is just increasingly getting higher. Because the overhead in the office is going higher, people's profits are going down. And unfortunately, because of that, the pressure to produce and sell more implants is just getting more and more and more. I'm seeing dentists all over the place come out of the woodwork and try to sell people implants, some of which they need, some of which they don't need. But I can promise you that the pressure to produce and do more dental implants is never been higher in my opinion, in all of the history of the profession of dentistry. So what can you do as a patient about these costs? Well, I have a couple of recommendations. As a general dentist has been doing this for over 12 years and placing implants for almost 10, there are a couple of ways that you can cut down the cost and or increase the success or get the best bang for your buck out of your dental implant. My first tip, I always tell people, do you really need a dental implant? Is somebody trying to sell you something that you don't need? Or is somebody trying to sell something that you're going to need but only 10%. Here's what I mean. Do you really need a dental implant on your back tooth? Your second molar, typically when those are lost, we always have patients just do nothing. So tell me in 2 months if you miss that tooth and you want it back. Some patients will say, I want that tooth back. Some patients will say, I don't mind missing that tooth and I don't really want to do something that they're going to be just as happy and satisfied without. Another thing is on a lot of these teeth, if you're not biting the opposing tooth, so let's say you're missing a lower tooth and you have an upper tooth and you're only biting on it 5 or 10%, I don't think it's worth $5,000, $6,000, whatever the price is, an expensive implant to put in that site. I don't think it's worth it. Honestly, you should just leave it and not do anything. Another thing is, what is the long-term prognosis of your dental implant? Now, I understand you as a patient, you don't know this information, but this is just good information for you to talk to your practitioner about. Will my implant last long-term? And what risk factors do I as a patient have to make sure that that implant isn't going to fail in 2 years, right? Dental implants are expensive, but what is more expensive is your implant not working out. It not lasting more than a couple of months or a couple of years. If you sink $8,000 into a dental implant only lasts 2 years, I would just simply feel horrible if I had placed that implant. So it's a good conversation to have before you get the implant placed. Is this something that is likely to fail? And we have lots of studies over the years to actually prove what causes implant failure. Smoking, diabetes, grinding your teeth. If you have a lot of these risk factors, it's not that you can't get a dental implant if you have a bunch of these risk factors. It's just you need to have an honest conversation about how long it will last and will it even actually take in your bone? Will your body even accept it in the first place? If you want to cut down on the dental implant cost, I would recommend getting dental insurance. Now, dental insurance is a little bit, dental insurance, there's a couple of little caveats with it because dental insurance can be tricky. They have this thing called a missing tooth clause. If you buy dental insurance and it has implant coverage, but you already come to the table with that tooth missing, a lot of times they're going to deny your claim because there is a missing tooth clause. But having dental insurance is going to cut down two different ways on your dental bill if you get an implant. Number one is it's just going to come down on the cost. If you have a dental implant, let's say it's just $7,000 and the dental insurance company says, hey, I'm going to only pay the practitioner $5,000, then the cost has already saved you $2,000. Now they're going to take a portion of that off your plate. And so maybe they're going to pay $2,000 off that. So your cost as a patient, instead of $7,000, now it's $3,000. So dental insurance, given there's no clauses and you are eligible for a dental implant and you have insurance coverage, it's actually a wonderful thing for you to have as a patient. It's just simply the best and easiest way to cut down the cost of getting an implant or multiple implants. I would also recommend you get your procedure done by somebody who is highly skilled. So an oral surgeon, periodontist, or general dentist that has had 5 years, 6 years, 10 years, 20 years of experience with implants. Because anybody can just place an implant, but not everybody can actually place it so that it is safe and effective and it's gonna last a lifetime for you as a patient. So this isn't really a way to save money, but it is to make your dollar go as long as possible. So if you're trying to save money and get an implant by somebody who's just, this is their first or their second implant, it better be so heavily discounted and warranted that you're gonna get a good deal out of it. Otherwise, you're gonna have to have it redone by a specialist anyways. If a general dentist or somebody places it for a lower fee, let's say for an example, and that implant doesn't work out, you're gonna have to refer to a specialist who's not gonna give you the discount. They're gonna wanna get paid for their services. They're gonna charge you the full fee. So get it right by somebody who has experience the first time. And to go along these lines, think about a dental implant as an investment. Just like people who do real estate, you're going to get a return on that in 20 years, in 25 years. Very few people get a massive return on their investments in stocks. Any investment that you make, in the short term, you may not get a huge investment. Same thing with a dental implant. Think about this as a $5,000 or $6,000 investment. Dental implants can improve the function of your bite, quality of life, improve your smile, be more comfortable for you, and lower the amount of dental work that you're going to need on your other teeth in the future. So as an investment, that $5,000 investment may not pay off for about 10 years, but in 10 years, it could save the other teeth from tipping. That causes malocclusion, that causes bone loss, that causes all sorts of other needed dental work that you don't have to have. So you actually might be saving money by investing in that dental implant just as though it was an investment. So think of it more of a dental implant, especially more as an investment instead of a massive cost that costs too much money that you don't want to spend. And if you're sitting at home and you're considering getting a dental implant or your doctor has told you you needed one, there are a couple of things that I would recommend as a dentist myself for you to consider. Number one is don't be fooled by the scam of just getting a dental implant that is $1,000. If it seems too good to be true, it is. I've seen advertisements from people, hey, dental implants are $1,000. Super scammy because what they're actually doing is they're only selling you the tires on the car. So basically, the dental implant comes in three parts. It has the implant proper, it has the abutment, and it has a crown. If they're selling you just the implant, technically, you're only getting the part that goes into your bone. They're not getting the crown, which is the only part that you feel as a patient. Also, if there's a better alternative to getting a dental implant, please take that. If a bridge is going to be quicker, faster, and better for you, do the dental bridge, even though it's not gonna function the same as a dental implant. I always like people saving money on things that are almost as good as a dental implant, but not quite, because I'd rather take that extra money that they're saving, they can spend it, or we can put it into other dental work that you need. It is a little bit weird too also when I see some patients take dental implants on one tooth and they have just a mouthful of cavities. It doesn't really make a whole lot of sense to me, and I don't like doing it, and I try to discourage people from doing a dental implant when you have, for the cost of that implant, you can actually spread that out. You can actually spread the cost throughout your entire mouth and get all of your cavities fixed, and then get that implant later. But first, let's fix let's fix your bite, let's fix your bone, let's get your gums healthy, and let's fix the cavity rate so that it doesn't go out of control, and then you need more dental work when you're done with your dental implant. So it is so don't spend all your money and put all your eggs in one dental implant if you have other dental work to do. That is cheaper, easier, and quicker to. Another thing is get a surgical guide. Sorry, whoa, I was kind of like burping as I was talking there. Another thing is get a surgical guide. Get a surgical guide that is going to reliably give give you a good position with that dental implant, because a couple of things could go wrong when you're getting an implant. One is we can actually put the implant in the wrong position, and then it's kind of sticking out the side, and it's very difficult to put a crown on there. If the implant is supposed to be here and it is tilted here, the angle's off, how do you put a crown in this direction on it? You can't really slide your crown here. Nobody wants a crown that is totally different than all the other teeth and makes you regret getting an implant. So a surgical guide is the best way, just in my opinion, to get the proper placement and keep yourself away from the risks of an implant, like nerve damage, going into the sinus, having sinus issues, getting a hole up there. It just essentially keeps you as a patient safe. And the last thing I want to say about dental implants is that there is something most people don't even recognize, they don't even know about this, and that there are two types of dental crowns for implants. Implant supported crowns, there are two different categories. There are screw retained and there is cement retained. Cement retained is basically we glob some glue in there and we just put it on the tooth and it dries, and then it is cement retained in there, permanently in there, never comes out. The problem is if you ever need to access that in the future, you cannot do it. Also, that cement is very, very bad for the dental implant, and implant failure has been well documented on cement getting down and touching that titanium surface, and then the implant fails because of that. So you have two major risks with that procedure. Talk to your doctor before they do the dental implant that you want a screw retained implant crown, if possible. What that is going to do is that it's going to provide a little hole, an access hole, if the screw becomes loose or you break the crown. We simply unscrew that crown and screw another one in. It's just like turning on a light bulb, super easy for the doctor to do. Very easy, you don't have to get numb. For you as a patient, it's very, very simple. So I always recommend screw retained implant crowns over cement retained crowns because patients just don't know the difference. They should know the difference. Their doctor should be open and honest with them. But a lot of times I'm seeing these cement retained crowns and it's like, why would a doctor knowingly place this? Because there is a better alternative. And in my opinion, a screw retained crown, if you can get it and you are eligible for it, is a far better device for a crown than a cement retained crown. If you watched the video this long, please give me a subscribe and maybe even make a comment in the comment section about what you think about dental implants. If you've had them and you agree with a lot of this information, or you have another point that you want to make, or you're a doctor listening to this and you want to help other people like I have a passion of doing on YouTube as a doctor, please leave your comments below. And dental implants are just simply expensive, and I don't know that those costs are going to go away anytime soon. I really appreciate people who can make it all the way to the end of these videos and can listen to me kind of ramble. I have a lot to say, but I have a lot of things that I want to teach, which is the whole point of this YouTube channel, that I am a semi-retired doctor that uses his extra time to help other people understand their teeth, better their healthcare, and maybe even save a little bit of money, which if that is you and you're watching this and I've helped you, maybe even save a little bit of money or had a little light bulb go off like, maybe I don't need that implant. Thanks, you just saved me 5,000 bucks. Leave your comment below because I love helping people and it just gives me a lot of satisfaction. The monthly amount of money I make on YouTube currently is $0. So the comments that I get from people, hey, thank you so much for this advice, really does me a huge favor, and honestly, just kind of feels good that I'm helping people. I'm just a dentist. Thanks again for watching. Watch these other videos and I'll see you on the next one.